News Center Maine is partnering with the Maine-Monitor to bring you the reporting being done by journalists at the independent nonprofit publication. One of the stories recently released was about 4 Maine hospitals that stopped delivering babies last year. One of the closures was in Holton, which means pregnant women across a large area of northern Maine now need to travel to Presque Isle or Bangor for care. So joining us to talk more about that overall and what that means for the region is Emily Hedegaard with the Maine-Monitor. Thanks, Emily, for joining us.
Yeah, thank you so much for having me today.
I want to start with this because you specifically spoke with one woman who had kind of a scary journey. She had an emergency birth, and it had already been after Holton had closed their maternity unit. So what did you hear from her?
Yeah, it's a pretty intense story, and I encourage people to read my article to get the full account, but here's the short version. I spoke to a woman in a small town in northern Penobscot County who was planning to give birth at home with assistance from her family doctor. Shortly after she went into labor, she faced a complication called a prolapsed umbilical cord, which is a medical emergency that can cut off the baby's oxygen supply. Her doctor quickly intervened and called an ambulance. Holton Regional Hospital, which was a 40-minute drive away, was the closest hospital, but it had closed its maternity unit a few weeks earlier. When paramedics called in with the emergency, the initial answer was no. The hospital wanted the mother taken to Bangor via helicopter instead. The woman's doctor didn't think the baby would survive the trip and pushed to get her into the Holton Hospital. Eventually that worked, and luckily there was a team on call for the transition period that was brought in to perform an emergency C-section. The surgery was successful. The baby is now 7 months old and doing well. Her mom calls her a miracle baby. But she is still worried about what the closure will mean for other women in the area, whether they just need prenatal appointments or emergency care.
You know, that said, what was the reasoning for Holton closing its maternity unit?
Yeah, great question. So the Holton Hospital announced the news last April, a month before the closure, which happened on May 2nd. Officials said it was necessary because of a decline in births and staffing challenges, as well as increasing financial pressures. I should mention that officials at Holton Regional Hospital did not respond to numerous requests for comments or to a detailed list of questions. So my understanding is based on their public statements and documents we obtained during the reporting process. The hospital in Holton was the 11th in Maine to stop delivering babies over the course of a decade, part of a growing rural maternal health crisis that's left half of Maine's 34 hospitals without obstetric services.
And just hearing that one story, that's terrifying. And if it hadn't been for her doctor pushing, who knows what would have happened. But overall, what does this mean for women in that region?
For many families in the area, the idea of going to Presque Isle or Bangor for maternity care is daunting, particularly in the winter. The extra distance raises the risk of complications both before, during, and after pregnancy. Since the closure, the family doctor in Patton who assisted with the emergency birth said she's seen an increase in the number of patients interested in giving birth at home, as well as patients choosing to be induced to avoid an emergency. There are also concerns about how the region's Amish community, who tend to use horses and buggies for travel, will reach the hospitals now at least an hour away by car. While most Amish women do not give birth in a hospital, 1 to 2 a month typically require hospital assistance. The doctor in Patton said she's had to assist Amish midwives with more complex cases since the closure.
So certainly a lot of impacts beyond just Holton.
Yes.
Emily Hedegaard, thank you so much for joining us to talk about this.
Thank you so much for having me.
And you can read the full story and a whole lot more at the-maine-monitor.org.